Tonight on 60 Minutes.
Hello, my name is Lauren Griffith, and this is 60 Minutes. Today we are Skype calling President Barack Obama from the White House to discuss his new reform on healthcare.
Thank you for having me, Lauren.
Mr. President, why did you see a need for the healthcare reform?
Before 2010, 79 million Americans were uninsured and receiving inadequate health care coverage to fit their needs. Also, health care was becoming more expensive faster than incomes were accumulating for middle-class families. As this was happening, benefits began to decrease and insurance companies were able to deny coverage to just about anyone, including those with pre-existing medical conditions. Therefore, health care has become a burden for all American families and something needed to be done.
How did you go about trying to solve this healthcare dilemma?
Since I took office back in 2009, I have been working on legislation to improve the United States healthcare system. On March 23, 2010, I signed the Patient Protection and Affordable Care Act, also referred as ObamaCare, into law.
What is your goal behind ObamaCare?
My goal is to ensure that every United States citizen has the access to quality and affordable health care in order to promote equality amongst the American population. By 2014, every American is required to obtain health insurance, making it more of the right for citizens.
How do Americans purchase health insurance through ObamaCare?
Well, employers with more than 50 employees are required to offer health care plans to their employees, otherwise there will be major fines. Also, individuals that do not have health insurance are able to find a plan that fits their financial situation through the health insurance marketplace or affordable insurance exchange.
Thank you for taking time out of your busy day to come meet with us.
You're welcome. Thank you for having me.
Hello, we have Dr. Susan Griffith here with us today. She's a pediatric orthopedic specialist at Doylestown Hospital, and she's here to talk about her experiences under Obamacare.
Thank you for having me on the show.
Obamacare offers a grace period rule to patients. How has this affected your practice?
Well, this is a difficult part of Obamacare that makes it rough to be able to treat patients. We don't know if they're paying their premium. We just assume that they are. If they're not, after 60 days, we're notified that they haven't paid their premium. So all of the services that we've provided over that course of 60 days, we then have to write a check back to the government for all of the costs that we had given to the insurance plan for providing that service for the patient. So, in other words, we're not getting paid for all of that work that we've done.
With more patients being added to Medicare, the government has significantly cut back on the reimbursement rates. How has this affected your practice?
Well, there's no real reason why they decreased the reimbursement, and then also the other insurance plans follow suit later on with that practice because they're based off of Medicare. We obviously, if we're not getting reimbursed that money, the same as what we did before, we're taking less home at the end of the year, and that also is reflected with our staffing because our overhead then has to be covered. So we're unable to give the bonuses that we did or the salary increases that we did, raises for our assistants.
Thank you, Dr. Griffith. In order to move forward as a country, we must fix Obamacare to not only help the patients, but the medical field as well.
Thank you.
There are two ways of solving Obamacare so that it does not continue to affect physicians and hospitals. The first solution would be to get rid of Obamacare completely. Without Obamacare, physicians and hospitals would be reimbursed for all of their work in handling patients. Also, already overburdened physicians and medical staff would not have to pay the high taxes that Obamacare forces them to pay. Eliminating Obamacare would prevent hospitals across America from making huge cuts to their staff and financial budget. Under Obamacare, the Cleveland Clinic, a world-renowned hospital and second major employer in Ohio, is forced to cut $330 million and lay off 44,000 employees. These types of cuts are being made to all hospitals, resulting in significant salary decreases and high unemployment. In in the American medical field. However, getting rid of Obamacare completely would not help those who are not able to pay for health insurance. Therefore, a better alternative would be the Patient Option Act, which is a piece of legislation introduced to Congress by Congressman and Dr. Paul Brown. Here is Paul Brown with us today to introduce his Patient Option Act.
For a solution. Fortunately, there is a solution. It's H.R. 2900. My Patient Option Act. The Patient Option Act is the only health care bill that completely removes the government from the doctor-patient relationship and puts patients back in charge of their health care decisions. It will make health insurance cheaper for everyone. It provides access to good quality care for all Americans, and it will save Medicare from going broke. This week, I am honored to announce that the Association of American Physicians and Surgeons has endorsed my Patient Option Act. With the support of associations like APS and through the voice of We the People, we can work to put in place true conservative solutions like my Patient Option Act. Mr. Speaker, I yield back.
Gentleman's time has expired. What purpose the gentleman from Florida rise?
This will lower deductibilities so that patients are able to afford health care insurance. For those that are still unable to pay for health care, they will still be able to be treated effectively. Under the Patient Option Act, there will be the creation of new tax incentives and rebates granted to hospitals and physicians that treat indigent patients. Economically, this is the best solution because premiums will decrease, allowing patients to consume more, and doctors and hospitals will be reimbursed for their care. The Association of American Physicians and Surgeons has stated that they look forward to supporting Dr. Brown's continued efforts to empower patients and their physicians.